fire somewhere other than the OR, you may hear terms like code red in the location, a thing called RACE. All of you should know about what RACE means. If you're there, you could be visiting somebody over in Med-Surg, you could be down in the cafeteria somewhere, right? Don't abandon the nurses that are up there. Again, you folks are a part of the team here, so you can stay and help. Just really quick, right? We need to get everybody out of the room. We need to activate the fire alarm system. They're gonna do overhead paging. They're gonna start with calling the fire department via 911. We're closing all the doors, and we are gonna evacuate individuals based on the conditions there. Any questions on that? Okay. All right. So for those of you that are interested in practicing with using a fire extinguisher, we have a bunch of them that are here today. So again, I can show you this, but until you get your hands on it, it's a little bit different. So with this, why do I have two? See the difference here? Dry chem, powder, all over the hospital, in all the cabinets. Okay, they are required to be there. They have to be less than 75 feet. General purpose, it's an ABC fire extinguisher, anything that you discover here. Now CO2, this one is just a little bit different compared to the one that you actually have in the actual OR as far as the hose goes, the cone. You'll see that once you get up there. We're gonna talk about this once we get up there as well. But we're gonna get, if whoever wants the opportunity to practice this, you guys are gonna get a chance to do that today. Okay, and I think that you probably should do that if you've never done it before. All right, with this, ABC, okay, rules. Everyone needs to be out of the room first. That makes sense, right? Like if I am, pull, aim, squeeze, sweep, and I'm spraying this all over the room, right? That chemical powder is literally going everywhere. Okay, so don't run out into the hallway, don't run down the hallway to try to look for one of these and bring it into the OR setting, okay? Now with that is, you don't even have to be that close. 7 to 8 feet away, that's about how far they'll actually spray. The fire or the flames should never be larger than the fire extinguisher that you're using. Okay, that's a really good way for you to judge whether or not you'll have enough powder. Okay, 22 years as a firefighter, I never once got off the engine holding on to one of these to go in and put out a fire, right? It won't work. So now with this, the CO2, okay, it's what they call a clean agent. So it comes out looking like snow. And so now with that, it is passed. Again, a little bit more rules. So if our table is here, patient's on the table, if we choose to use the fire extinguisher, fine. Again, you have a bunch of different options that you can utilize before even you get to this. I'm not really sure that spraying this at your patient's face really is probably the most appropriate thing. Again, you have options, you have your saline, we have towels, we have sheets, all of that. Really what I think is probably more practical is, hey, once we got all that stuff removed, we put it out, we got it over on the floor and it flared back up again. Well, now I can use the fire extinguisher to put that out. So with that is pass, pull, aim, squeeze, sweep. Step number 1, pull out the pin. So do I need the pin anymore? Don't need it anymore, chuck it. Okay, if you want to be dramatic and chuck it like a grenade, that's fine. Okay, so aim at the base of the fire. Don't get caught up in the flames. That's just gas that's burning. We need to aim at the base to put that item out. Okay, whatever it is. Squeeze, sweep. Now, when we're sweeping, it's not sweep the whole room. It's right at the area where the fire is. If you put the fire out, all you gotta do is let go and it'll stop spraying. Okay, so here with this is, we'll only get a few opportunities to do this today, but sometimes the fire extinguisher folks, this little safety tab, they will like reef this thing on, like really squeeze it on there, and you may not be strong enough, right, to pull it out. So all you have to do is push it forward and it breaks. It's very simple. So with this, I pull out the pin, let it go. This one just happens to be tethered to the actual fire extinguisher. Now watch, okay, a little loud. See what I'm talking about now? So again, I don't really know, like spraying this at somebody's face is probably the most practical thing. The fire extinguisher, the CO2 that you have, is actually like tethered to it. So there's a steel piece that's here, the cone comes out, you don't even have to hold on to the cone. Because if you're spraying and you're holding on to the cone, right, it comes out looking like snow, so what's gonna happen with the plastic? It starts to freeze over, and so your nitrile glove, if it's a little moist, what's gonna happen? Right, permanent reminder of a mistake that you made. Ouch, okay? So you don't have to hold on to that once you get into the OR setting. Okay with that? Found a while, like, yeah, I've done this, like, this is like my 20th time doing this. Come on up, we'll run through this quick, we'll get you in, get you out. You gotta do it, right? You gotta do it. It's a good practice, it's a good reminder. Again, fires do occur. So now with this though, right, like, again, we're using sheets. So if I do this, right, like, what did I just do here? I just added fuel, right? So we just have to be quick. Our head's here. We're gonna sweep everything this way. It's very simple, it's lighter fluid. It's not like it's a huge raging inferno anyway. Again, very simple process. So come on up, that way. Go right into it. Good, awesome, yep, good. So you notice that it didn't really go out completely? Good job with that. Awesome. Go right into it? Why not, right?
Yeah, that's right.
Okay.